Oesophageal cancer. Oesophageal cancer is a malignant tumour of the esophagus and is classified into two main histological types: adenocarcinoma. This most commonly affects the distal third of the esophagus. It typically arises from Barrett's esophagus and is associated with gastroesophageal reflux disease, GORD, and squamous cell carcinoma, SCC. This more commonly affects the upper and middle thirds of the esophagus. It is strongly associated with smoking, alcohol use, and achalasia. Peak incidence. Esophageal cancer most commonly occurs between the ages of 60 and 70. Pathophysiology. Adenocarcinoma arises from metaplastic columnar epithelium in Barrett's esophagus due to chronic acid exposure. Squamous cell carcinoma originates from the native squamous epithelium and is associated with chronic irritants such as alcohol and tobacco. Both types can invade locally, cause strictures, and metastasize via lymphatic or hematogenous spread. Symptoms: progressive dysphagia, initially to solids and later to liquids. Unintentional weight loss. Oesophageal, which is painful swallowing. Hoarseness or persistent cough. This is due to recurrent laryngeal nerve involvement. Hematemesis or melena. This is from an upper GI bleed. Anorexia and vomiting. And respiratory symptoms, for example breathlessness, cough, due to aspiration or a tracheoesophageal fistula. Signs: cervical lymphadenopathy. This may present as a palpable left supraclavicular node, Virchow's node, which suggests metastatic spread. Hepatomegaly. This also suggests liver metastases. And signs of anemia from chronic blood loss, for example koilonychia, angular cheilitis, and glossitis. Diagnosis: urgent referral. 2-week wait referral criteria in the UK. This is for any patient with dysphagia, adults aged 55 and over with weight loss, and any of the following: upper abdominal pain, reflux, or dyspepsia. Consider urgent referral in patients with hematemesis or other red flag features. Investigations: blood tests. Full blood count, FBC. This may show iron deficiency anemia. Liver function tests, LFTs. These may be abnormal if liver metastases are present. Esophagogastroduodenoscopy, OGD, with biopsy. This is the gold standard for diagnosis. CT thorax, abdomen, pelvis, CT tap. This is first-line imaging for staging. PET CT scan. This is used to detect distant metastases. Additional investigations if indicated. Bronchoscopy. If the tumour is near the trachea or main bronchi, this can be used to assess airway involvement. Barium swallow. This may show an apple core lesion or irregular narrowing. Diagnostic laparoscopy. This is sometimes used to assess peritoneal spread, especially in adenocarcinoma. Complications. Progressive dysphagia. This leads to weight loss and malnutrition, and there is a risk of aspiration pneumonia. Tracheoesophageal fistula. This results in recurrent cough and repeated aspiration. Metastatic spread. SCC, squamous cell carcinoma, tends to metastasize to the lungs and mediastinum. Adenocarcinoma. This is more likely to spread to liver, peritoneum, and bone. Esophageal obstruction. This can lead to complete dysphagia and anastomotic leak post-surgery. This may result in mediastinitis, a life-threatening complication. Management. Curative options for localized disease. Endoscopic submucosal resection. This is for very early stage tumours confined to the mucosa. Neoadjuvant chemotherapy. This is used for locally advanced disease prior to surgery. Surgical resection, for example oesophagectomy. This is in fit patients with resectable disease. Palliative options for advanced or metastatic disease. Endoluminal stenting. This is first line to relieve dysphagia and improve oral intake. Chemotherapy and/or radiotherapy. This is used to control tumour growth and symptoms. Percutaneous endoscopic gastrostomy, PEG. This is for nutritional support in those unable to eat. And supportive care and symptom management. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today